The purpose of this video is to demonstrate how to use the PT press. In the folded position, the PT press has a handle exposed for easy carrying and transport. To set up the PT press, find an open wall space or otherwise stable surface. Put the PT press down flat with the wall bracing portion close to the wall. Pull up on the foot plate, allowing the stabilization bar to travel through the tunnel. Bring it up through the tunnel notch, and then choose one of 3 varying notches for varying foot and ankle range of motion. We recommend that you start at the lowest notch to allow for patient dorsiflexion restrictions. Then place the press against the wall. Now you can also adjust the heel rest. It has a hook and hole mechanism to move the heel rest up or down to allow for short legs, long legs, varying wheelchair heights. We recommend you start with the lowest notch the first time you use it with the patient. Now you bring the patient, while they're seated in the wheelchair, up to the PT press. Help the patient put their feet up on the foot plate, heels against the heel rest. The therapist stands behind the patient, and you're ready to use the PT press. To use the PT press, the therapist gently pushes the patient in the wheelchair towards the wall, bending their hips and knees. The therapist then extends their hips and knees while the therapist gives manual resistance. Okay, Jessica? Start out gently and then add resistance as appropriate for each patient. Bend and push. Bend and push. Good. The therapist can customize the reps and sets to meet patient needs. And push. Good. Another option, if we want to isolate one lower extremity with this exercise, is to put the foot up on a wheelchair footrest and then one foot by itself up on the PT press. Then gently, again, push the patient towards the PT press, bending the knee, and the patient pushes back, give gentle resistance. And push. Good. And push. Another option is to have the patient raise their arms. Some patients want to push with their arms on the armrests and push. By doing this, you make their trunk work a little harder while you're doing the leg press exercise. Another way to make the patient work a little harder is to have them lean forward slightly, just a couple inches away from the backrest, so they can't push their back into the backrest and compensate that way. You can either have them lean forward or even scoot forward a couple inches in the chair. And then we bend the knees and push. This is making the patient work on their posture and their trunk position while they're working the legs. Again, we can add the arms. So we're incorporating more of the body with this exercise. If we want to make it even harder for the patient, we can incorporate more upper extremity strength, give the patient a TheraBand, have them put their feet up on the foot plate. You can have them lean slightly forward, extend their elbows out, and when they push with their legs, they're going to pull with the arms, working both the arms and the legs. Ready, Jessica? Go. Good. And push and pull. Good, Jessica. Push and pull. This works coordination, arms, legs, and trunk all at the same time. If you're having problems with the patient's feet slipping off the footrest, an easy fix, slap a little Dicem on and bring the patient's feet and put it right on the Dicem on the heel rest. Another option, in case you've had a patient who's had a stroke, has one side that's flaccid or low tone, the leg is not positioning very well, we can use a gait belt around the legs, and the strong leg helps keep the weaker leg in position. Then when we push with the PT press, we see that crossover facilitation going into the affected side. Sometimes in therapy, the patient gets scooted too far forward in the wheelchair. A lot of times this takes 2 or 3 therapists to reposition them. It's not real safe for the therapist or the patient. With the PT press, we have another option. The patient scooted forward in the wheelchair, place their feet up on the footrest, push them forward so their knees are bent, and then lock the brakes. Now with this one therapist, grab the pad that's underneath of them, count to 3 and scoot back. Ready, Jessica? 1, 2, 3. With this, I just lift up a little bit, allowing the patient to scoot themselves back. Safer for the patient and the therapist. When using the PT press, think about the diagnosis of your patients and take proper precautions. If a patient has dementia, they might not be able to understand how to use it. Patients with spastic tone might not be able to use it properly. Patients with wounds, of course. Patients who have limited weight bearing, although a patient who is limited weight bearing on one leg, we're asking that geriatric patient to hop on their good leg. That leg needs to get stronger and be perfect for the PT press. And of course, patients with fused joints you would want to be cautious with. When you're finished with the PT press, to collapse it, take the stabilization bar through the last notch, allowing it to slide along the tunnel and out the back. This collapses it down into a nice, compact, easy to carry device. Don't be worried if you don't do this right the first time. What a lot of people do is grab it by the foot plate and pick it up, or grab it by the handle and start to carry it. This won't hurt the PT press, but it's not a very compact device for storage. So remember, take the stabilization bar into the last notch, along the tunnel, and out the back. And it slides easily under a mat, table, or bed. We hope this helps you use the PT press, and we thank you for choosing to use the PT press. If you have any questions, you can contact us by phone or email. Thank you.